When I go to the ER for flu, how do they know it's severe? When you arrive at the emergency room with the flu, healthcare providers look carefully at your symptoms, vital signs, and overall condition to decide if your illness is severe. They check for signs that your body is struggling or that complications are developing. For example, difficulty breathing or shortness of breath are serious signs because they can mean your lungs are affected, possibly by pneumonia. If your fever is very high and doesn't respond to medication, especially over 100 degrees Fahrenheit or even 100 degrees Fahrenheit, it suggests your body is fighting a more serious infection. Chest pain or pressure is another red flag because it might indicate lung or heart issues linked to the flu. Doctors also watch for mental changes like confusion, dizziness, or sudden mental status shifts, which can show that your oxygen levels are low or your infection is severe. Bluish or gray lips or face are signs that your body isn't getting enough oxygen and need urgent attention. Severe dehydration is another concern, especially if you have extreme thirst, very little urination, dark urine, or feel lightheaded. If you are vomiting persistently or cannot keep fluids down, dehydration can worsen quickly and needs prompt care. Children with severe muscle pain or weakness, especially if they refuse to walk, are also evaluated carefully because their symptoms can escalate fast. People with underlying high-risk conditions such as being over 65, pregnant, having chronic health issues, or a weakened immune system are more vulnerable to serious complications. In the ER, doctors perform tests like rapid flu tests or more precise PCR tests to confirm if you have the flu. They also monitor vital signs such as heart rate, breathing rate, and oxygen saturation levels. Sometimes they order chest X-rays or blood tests to check for pneumonia, sepsis, or other complications. Deciding if the flu is severe involves looking at how intense your symptoms are, your risk factors, and what the tests reveal. If your condition shows signs of breathing difficulty, mental confusion, dehydration, or other serious issues, it indicates that your flu has become severe enough to requiring hospital care. Recognizing these signs early helps doctors provide the right treatment quickly, which can prevent worse outcomes. Always seek medical advice if you're worried about your symptoms or if they suddenly worsen.